Okay. Yes, we also record. Okay. Yeah, it's you guys start. Hi, Nana.
Hi, are you able to hear me?
Yes, you guys start now.
Okay. Good evening, everyone. Welcome. Thank you for taking the time to join us today. I will just give people 2 more minutes to join the call, and then we can start at 18:05. My name is Nane Sijuka, founder of Sickle Cell Awareness Initiative, very proudly Team Sickle Life today. And this is Let's Talk Sickle Cell Disease. So we'll give it 2 more minutes and then we'll go. Okay, I think we can begin. Good evening again. Thank you so much for joining us, taking the time to be with us tonight. This is Let's Talk Sickle Cell Disease. It's a conversation series that was coined by Sickle Life, and we meet here to discuss all things sickle cell. And today we are talking about sickle cell disease and advocacy. One of my co-founders, no, my co-panelists, Dr. Enam Bankers, who's the founder of Sickle Life, is here today. So I think it's only right that I let her speak on Sickle Life and Let's Talk Sickle Cell Disease, and then I'll come back to you in just a moment.
Hello, everyone. Good evening, and thank you very much for joining Let's Talk Sickle Cell and Advocacy. So, as you all may know, Sickle Life is a sickle cell disease health advocacy group with the aim of educating the public about sickle cell disease to empower them to make informed decisions about the condition. And informally, we started in 2013, and it was born out of my personal struggles with sickle cell disease at the time when I was first diagnosed with avascular necrosis and head of FEMA. And so I started blogging about the condition, and I realized that there was a lot of interest in it And with time, the scope of our work increased from blogging and health education to a lot more activity. So we had our first actual program after our registration in 2016 as a non-profit organization. And so there we screened, someone is, sorry. Okay, so we screened about 100 people. We had health talks, we had genetic counseling for the people, and that was very beneficial. Then moving on from there, we introduced the mentorship project. We also started doing support for our beneficiaries. So we had our welfare programs, a lot of other programs where we engage with our beneficiaries. And so these are things that have been going on over the years. And so with time, our numbers have increased such that the direct number of beneficiaries on our WhatsApp platform is about 250. But we know that it's exponentially more across the country in terms of the people that sorry, my line was going in and out. I was getting a number of calls. So
Okay, do you hear us now? Are you back on?
yes, I'm back on. Sorry about that.
No problem, no problem. Thank you so much. That was good. I appreciate the feedback. So today, like you mentioned, we're here to discuss sickle cell disease and advocacy. I think for the PAG representatives, and for those who don't know, PAGs are patient advocacy groups, similar to NGOs who work specifically for patients. But for those who know here, we were all represented at a just ended summit for sickle cell disease advocacy. And it was Ghana's first. So we were very pleased and very honored to be there. And I'm sure I don't speak for just myself when I say that there were a lot of very interesting conversations that were had about the state of sickle cell disease advocacy in Ghana, the history of sickle cell disease advocacy in Ghana, the way forward for sickle cell disease advocacy in Ghana. And so we found it only fitting to have Let's Talk Sickle Cell Disease today focus on advocacy and keep the conversation and the momentum going. And so that's what we'll be speaking about today. We have some very, very well-seasoned panelists, co-panelists today. Our moderator was set to be here, but I am filling in for him until he arrives. So in the interim, I will be a moderator myself and a co-panelist as well. And I am joined by Dr. Enam Bankers. I'll let her speak a bit more to her interest in this topic. I'm also joined by Nanama Nani, and I'll pass it over to her as well in just a second. And I'm also joined by Enoch Kingsley Quay. And those are my co-panelists for today. I'll let them speak on their own journey with advocacy and just say hello to you, and then we can just get right to it. Dr. Bankas, off to you.
Hi everyone, hello again. So and I'm Bankers, founder of Sickle Life. By way of introduction, so I'm a person living with sickle cell disease, SC genotype. I'm also a health advocate, and I actually think that comes before my medical practice. And then I'm currently in residency to be a specialist hematologist. Hopefully next year I'll be done with that. And I'm the founder of Sickle Life. So I am basically the team lead for all the programs and activities that we do. A lot of the advocacy work that you see us do, I am the person who essentially runs a lot of it, but then I do that with a very strong team of administrators who we have specific team leads for the various aspects, and I'm sure you get to engage with a number of them through our various activities. Thank you.
Thank you. Thank you so much. It's a pleasure co-hosting with you today, having you as my co-panelist, excuse me. Nanama, please introduce yourself, and if you don't mind, can we see you?
Hi everyone, I'm Nanama Nani. I'm also a sickle cell patient and nurse, and I'm currently not working now. And I'm also part of Sickle Life and helping to advocate against sickle cell. Thank you.
Thank you, Nanama. It's a pleasure. Mr. Quay, over to you.
Hi, everyone. So as introduced, my name is Kingsley Quay. And so I started my advocacy journey with, and I'm just helping her in the very beginning when we were trying to set up Sickle Life. And she has started blogging and writing about it to the very first event. So initially I was a volunteer with the team, then eventually served as an admin for a number of years and as the head of the business unit. And now, more specifically, I just play a more advisory role. And I hear, and I mentioned and introduced the fact that her journey started because she was diagnosed. And Nani also mentioned the fact that she's also a person living with sickle cell disease. I'm not a person living with sickle cell disease. And I'm hoping that in this conversation, I'm able to highlight the fact that you don't have to be a person living with sickle cell disease or closely related to someone who has sickle cell disease in order to advocate for sickle cell disease. Thank you.
Thank you for that insight, Enoch. I see that my original moderator is here, and so I will hand over to Felix. We have just introduced ourselves, and so you've come at the right time. I will let you take it from here. Good evening, Felix.
Good evening, Anesi. Thanks so much for filling in.
No problem.
Sincere apologies to everyone.
No problem.
I was Ghana. You can't really predict how life can sometimes be. And I was driving and there was no way I could come online. So I had to wait till I got home.
No problem.
Okay, good evening, everyone.
Good evening.
Good evening.
Okay, so should I just start from where I'm supposed to start off?
Wherever you're comfortable, yes. We
That's
just
fine.
introduced ourselves, so yeah.
Okay, so my name is Felix Amano Otu, and this is my first time here hosting Let's Talk Sickle Cell Disease. This initiative that, Sickle Life uses to educate most of their members and the public as a whole. And it's something that is done every month. Every month a topic is picked, and then we try and then explain things for people to understand sickle cell disease more, and then to better take care of themselves. Today is a very interesting, topic for us to discuss because it has to do with, how to give better service and assistance to our members, I mean, our sickle cell warriors. And advocacy, I believe, it's not just something for some specific people. This cuts across everyone. And recently, when we had this conference we attended, I think it was made clear that advocacy begins with you. But today we are not talking about our advocacy. We are talking about organizations, bodies, and what they are doing to support, you know, sickle cell warriors. So we'll kick off. Unfortunately, I wasn't here when the introductions were done. So I would plead with you if you can introduce yourselves again, or you just move on. So on our panelists for today, we have Nanesi Duque. I think she stepped in for me whilst, you know, I was away. And then we have Kingsley Kwe. I think Kingsley was talking when I came online. There is also Nanama Nani, and then Dr. Bankers. So to my panelists, what is advocacy? I've said a few things already, but anybody can take this. What is advocacy? In your own words, how does this word advocacy inspires you to do the things that you do? Hello. I hope I can be heard.
Hi, Felix.
Yes.
Yes, you can be. So to me, advocacy is calling attention to a topic or an issue that needs to be discussed, right? And so there are various ways in which this can be done, and then there are various aspects of it. So for me, sickle cell disease advocacy is about calling attention to sickle cell disease and bringing the minds of people to certain aspects of the condition that they ordinarily wouldn't think about, and because they see it from the perspective of outsiders. And as I said in my introduction, I first started Sickle Life because there was a pivotal moment. I had just been diagnosed with avascular necrosis when I was in medical school. And that sudden change and the challenges I was facing at that time made me want to talk more about the condition. And so at that particular time, even though I had been living with sickle cell disease throughout my life, and I'd been dealing with certain challenges with the condition, and I was probably advocating for and about sickle cell disease in a lot of small ways, talking to my colleagues, talking to my friends, posting about it. There was a pivotal moment where I had undergone a certain challenge with sickle cell disease. And then it was like, there's a lot more about this condition that people don't know about. Apart from the crises and things like that, there are also complications, and it can affect your mobility. It can affect your quality of life. It can totally distort your future. So then at that point, it became a point at which I was like, okay, let me step this up further and start writing about it. And even then, at the point at which I started, it didn't stay where I started. It evolved over time based on the challenges in the system and based on the challenges that people presented to me. And so we started adding on bigger and better programs based on the peculiar needs that we saw in the community. So for me, it's about drawing attention to a peculiar problem, and especially certain parts of the problem that people will ordinarily not think about. So that's what advocacy means to me.
Thank you, Dr. Bankers. Nanesi, I see you are live again. Can you share your thoughts on what advocacy means to you?
Yes, thank you, Felix. Similar to what Dr. Bankers said, I think it's public support for a particular cause, right? So anything that you do, if you're an advocate for it, then the work that you do is not behind the scenes, you're in the foreground and you are working on behalf of, you're taking action for that cause. Like Dr. Banka said, you're drawing attention to that cause. And for me, specifically as it relates to sickle cell disease, I got into advocacy, I would say formally in 2015. I had been treated in several places. And I think I identified really quickly that the gap that existed in Ghana was mostly a knowledge gap. Of course, there's an infrastructural gap and there are other challenges that I'm sure we'll get to, but the biggest thing, which I think is the root cause of all the other challenges that we have, is a knowledge gap about sickle cell disease. And that trickles down into care, access to infrastructure, resources, investment, research, funding, and so on and so forth. And for me, my work as an advocate was to bridge that knowledge gap and do it publicly in a way that more people have access to information, more people have access to insights. And it was important to me, particularly, that I can work with the other people who are also public advocates for the cause and who are working on behalf of that cause. And so for me, that's what advocacy means, particularly for sickle cell. And that's the work that we've been doing since 2015 and formally in 2018.
That's good to know. But I'll be glad if you could share with me, I mean, or with all of us, some of the work you've done so far, you know, with your organization.
Sure. When we started working informally before we had an official launch, a lot of the work that we did was research work. And I think to be a successful advocate, you have to understand the terrain that you are going to play in. It's crucial, it's critical that we don't nosedive into the deep end without a proper knowledge of what we're going to do and what the status of things is in the space that we want to advocate in. And so for me, the biggest thing that we did was we were working with key stakeholders who are also involved in the cause or affected by the cause. And this is broadly patients, healthcare professionals, legislators, caregivers, and so on. And so really speaking to them and understanding, okay, what is the state of sickle cell disease in the country? What do we have? What don't we have? What's missing in terms of we're nearly there, but we're not there yet. So research was very critical, and that's where we're able to unearth a lot of information about what the state of things was. And that was what drove our mission and our vision and building out what we were actually going to do over the next 5-10 years. Then we went into, okay, we've done a public launch. Now we're going to address these things that we've seen that is missing in terms of a knowledge gap. And so education was primordial. It was, okay, we need to speak to people about the things that they are concerned about, which is what is proper care for sickle cell disease, what is proper management. So a lot of the work that we did immediately was direct contact with people and giving them the information that they need face to face, whether it be a seminar, going to schools, is where the stakeholders were, that's where we went. So we went into hospitals to speak to healthcare professionals. We funded training for HCPs. We would speak to patients directly. For those who needed financial support, we made sure that we were raising funds that go directly to affected persons. We were speaking to legislators to find out what have you done, what's missing. And so education was the first thing. I think within the first year, we were able to reach 86,000 people with the work that we did, just get the information to people. That was our first thing. And then after that, it went to infrastructure work. We spent some time doing some infrastructure work. And then with time, I'll speak more to the collaborative work that we've done, which is the work that I'm most proud of. So that's some information about the work that we've done so far, Felix.
Wow, that's really impressive. Can you share with us some of the challenges you faced while doing some of these things?
Yes, of course I can. I'm hoping that some of my co-panelists will also speak to their experiences, and then you can circle back to me.
Okay, that's fine. Enoch, in your presentation, you did mention, I think I heard you mention that you started, Sickle Life with Dr. Bankers. Can you throw some light, on some of the challenges you experienced whilst, starting an NGO, an organization for the first time? You had a passion, you had a drive, you wanted to do this, but definitely there were some hitches along the way. Can you share with us some of the difficult moments you experienced whilst, going all out to advocate?
Hi, Felix. Thank you for the question. So I think one of the key elements, if not the first element to advocacy is, raising awareness and working with like-minded people to make a change to a particular subject. In this case, sickle cell disease and its management in Ghana. And so for me, when NM started, and so just to clarify, not that I'm a co-founder or anything of Sickle Life, it's just I was there with her in the very beginning, helping. Just wanted to put that out there. But firstly, identifying with and I'm believing in what she wanted to do and seeing the need for advocacy and also aligning with her goals and volunteering my time and resources to make sure that our voice is heard. And I think in the beginning, some of the challenges that we were having, even within Sickle Life itself, was just aligning. Sometimes you find like-minded people, but when you have a vision of what you want to do, and those who come along do not also carry that vision, then it tends to put some impediments along the way. And that is heightened, especially when you have to work with other organizations who also we are all working in the ecosystem, trying to advocate and bring solutions to sickle cell, the problems that we face in sickle cell disease. But sorry, I just got a call there. But sometimes the people or organizations that you believe have the same goal or are like-minded do not align. And that was one of the things that we started facing right from the beginning. So it was very difficult because we've always had the mindset of collaborating and working with other organizations. In the beginning, we spoke to so many organizations. It was very difficult to find a partner which had the same passion and drive and just their approach to issues like the way we did. So that's number one. Just finding the right partners, both internally and externally. Secondly, there was also the issue of finance, but I think that cuts across for a lot of, I'm pretty sure Nanisi has her own stories when it comes to Sky. That was difficult in the beginning, just finding the right resources because you have your goals, you know the things that you want to do, you know the areas that you want to go to and the issues you want to address. But these things take money. And starting out, Enam was just finishing medical school. And I remember there was the first event that we had, she was doing, I think it was her first year housemanship. And it was in Kolebu. And we're having meetings in her room, having to call on friends to support and donate and give money so we can, when we're taking all sorts of donations, wristbands, food and all of that. So there was also that challenge. But I think that at the end of the day, the passion and the work will speak for itself, which is why Sickle Life is still here today advocating. And fortunately for us, even in the earlier problems that we faced with collaboration, whilst we've come across people who have shared in the vision that we have, not just people, but individuals, not just people, but organizations as well, like Sky, that also share in the vision. We've worked with some multinational agencies who have also shared in the vision that we have. So that's pretty much it from my experience. That's the challenges that we faced.
Okay, thank you, Enoch. Dr. Bankers, do you want to shed some light on some of the challenges you face? Enoch talked about passion. Passion is also one of the biggest resources, for any organization. But passion without the necessary financial resources and a team that understands the vision that you actually have, that can be a setback for an organization. How did you manage to pull through all these, some of these barriers?
So I think Enoch has captured the most important or the biggest challenges that we faced starting up and even currently. There have been other ones in terms of political will and interest from the health sector or government. There have also been other things in terms of the landscape. And I guess that can be captured under the whole thing about the people who are aligned in terms of alignment in the overall objective of advocacy. But in terms of how we've been able to overcome, it's perseverance and being dedicated to the cause. This is something that I'm fiercely passionate about. And despite all the challenges, despite all the difficulties, I'm still willing to push through. So irrespective of the difficulties and irrespective of the challenges, I still motivate myself with the facts or with the knowledge that there's impact that has to be made. And I keep looking out for people or volunteers who are aligned. So yes, there have been a number of volunteers over the years, there have been admins over the years, but then there are some people that shine through. And so once we find those people, we stick with them and then we work together to achieve our goals. And then unfortunately, because of that, there are sometimes that there will be certain disagreements because people don't align completely with the same goal, or because of the NGO landscape that we are used to. People think that you can take advantage of the system or you can get certain personal benefits from being part of an NGO. But as you guys know, I don't tolerate that. So sometimes in my dealings with certain people, you realize that we don't agree in those kinds of respects. And so we just part amicably so that then we can, those of us who are aligned in terms of our ethical principles for advocacy will continue together. And it's been the same principle that has guided my interactions with other organizations, those we partner with, to the multinationals and with the other NGOs. We also look at people who are aligned with us in terms of how they operate their NGOs, the kinds of principles that they follow, the overarching objectives and stuff like that. So then in the end, there are a number of things that I personally don't put a lot of effort into, or I don't spend time doing, because I feel like they don't help us to achieve the main objective that we are seeking to do. So if I find a partner, for example, Sky, that is very serious and is dedicated to the cause, they know that we would work together and would achieve a lot of things together. If, however, we attempt to work with an organization and we see that there are disagreements on basic ethical principles or on management principles, then we try very hard to complete whatever it is that we have to, and then we part ways amicably. But then if there are other opportunities for us to work where there won't be any disagreements on such principles, then would work together. So that's how I think we've been able to meander through this very difficult space. We find those we are aligned with, and then we work with them, and then we are amicable with everyone else.
Thank you, Dr. Bankes. Okay, so I think we've covered enough on advocacy. I mean, the work itself and some of the challenges we face whilst doing the work. Now I want us to come home. I mean, this webinar is for persons living with sickle cell disease. How difficult is it? And this goes to all my panelists. If maybe I should start with Nani Owusua. How difficult is it, you know, to advocate for persons living with sickle cell disease?
Okay, I'll start with me. I always wanted to advocate for sickle cell. So in 2019, during the World Sickle Cell Day, when I had the opportunity to meet Sickle Life, I just told myself, this is a good opportunity for me to help those with sickle cell because the stigmatization was too much, especially in the hospitals, families, and friends. So living with sickle cell, it's very difficult and people don't really understand us. They think we cry out because we think we are in pain, and they also think it's spiritual and other stuff. And the way our families and friends handle issues wasn't really pleasant. So when I had the encounter with Sickle Life, I just told myself, hey, this is the opportunity for you to help people advocate and let people understand the condition more as you expect them to. So in 2019, I just told myself, let me do this. I can do it. So let me just do it. So with Sickle Life, thanks to Dr. Bankers, I've been able to get opportunity to talk a lot for my people and for myself and for everyone that doesn't have the understanding about sickle cell disease. And it has really helped a lot. Though there are a lot of challenges, people think because you are also a patient, you are speaking for them. But I see it to be as their ignorance of whatever that is happening around us. They always think it's because you are in the condition, because you are facing it, so you are speaking for them. And it's not that way. I don't see it to be that way. So advocating really helps. It really helps a lot. At first, I wasn't really proud of myself. Telling people I have sickle cell disease was even a big problem to me. But now I stand out bold. I post them on my status, my family members, and I tell them about it. I don't even care what people think about it and other stuff. And normally the questions they ask us, are you sure you are one? And I'm like, how do we look like? If am I sure I'm one? Am I supposed to be two or three or what are you expecting to be like? But when you're able to talk to them for them to understand, then they come to the understanding with you that this is how the whole sickle cell disease issue is. We are suffering a lot and we have to go out and advocate. We have to let people hear us, especially health workers. They have to hear us and know how to treat us and have a comfortability when we go to the hospitals. Thank you.
Thank you. So help, like they need to hear us, they need to know how to treat us. We'll come to that. And I'm glad from your presentation, you did mention that your advocacy is not just for yourself, but you do advocate for others too. And I'm glad now you are proud and you are out and you are sharing, you know, the knowledge you have. You did mention, however, that there are difficulties and people find it difficult to understand. Can you tell us some of the difficulties and what really, you know, is there to understand? I mean, we want to share this information. We want others to know what we know. So can you tell us, you know, what are some of these difficulties that you talk about? And then what understanding would you want people who don't really have enough information about sickle cell, sorry, and our health workers who handles our sickle cell warriors? Can you share with us some of the knowledge you want them to know? I mean, some of the things you want them to know and some of the difficulties, the things that make it difficult for advocacy to be done.
Okay, thank you very much. Some of the difficulties are, one, as a patient, whenever you are in pain and you go to the hospital, and excuse me to say, you are screaming and making a whole sort of noise, they think you are doing that screaming or shouting for them to have an attention on you. And it's not that. It's not that we feel like let's scream. No, sometimes we feel like let us endure it. But the kind of pain that we go through, you can't endure it. You can't. And you going to the hospital and they'll tell you, sit down, we'll attend to you. And you can see that the health workers are not really much busy and no one is attending to you and you are in pain. They think we want attention. And some comments that come from them are, let me use the tree language, like, what's some bahabium? You've been here again. You're always coming here. Do you feel happy coming here? I see we find delight in going to the hospital, or maybe there is something nice in the hospital that pushes us to the hospital. It's not like that. We are in pain. We are suffering. So when we come there, we need the attention. We need the support. We need them to even talk to us, even tell us ways and means to handle our stuff before even coming there. And also to our parents and our community, they shouldn't think sickle cell disease is like romanticism. It's way different from romanticism. Fine, though some of the symptoms are of romanticism, but it's not like that. It's not. And they shouldn't expect us to have, if sickle cell A, it's slim and looks tiny, doesn't mean that the second person should also look slim and look very tiny. And if you don't look that way, meaning you are telling lies that you have sickle cell. No, we are all coming from a different home, and we are different. Like how God created us is different. And moreover, the way I will handle my condition, that is not the same way someone can handle it. The kind of pain I can handle, someone can't handle that pain. So if you are not going through any pain, don't think our pain is true exaggeration or true attention. Thank you.
Thank you, thank you, thank you. We all have different pain tolerance. We may be in the same hospital. One will be screaming and I'll be sitting quietly, but you have no idea the level of pain. And I'm glad you mentioned that rheumatism, Sasabro, is not sickle cell. Thank you so much. So to my next question, looking at all these things, how best do you think we can advocate for persons living with sickle cell disease? I mean, Owusu mentioned pain management. You know, recently I was in a hospital, I had to visit someone, and I mean, one of the reasons why we get admitted is because of pain. and you want your pain, at least you want to see progress in your pain. I mean, once you're being given infusion or some pain meds, you want to see your pain decreasing. But this pain keeps, persisting. How best can we, advocate for persons living with sickle cell disease? And this probably, I think I'll allow, Nanesi has been quiet for a while. I'll allow Nanesi, no. Okay, Dr. Bankers, please take it for me. The next question is for Nanesi.
How best can you advocate for people living with sickle cell disease? I think it has to be a multifactorial approach. There are several aspects to how we can address sickle cell disease, because as you can tell from what Queenie said, there are so many challenges. There are health system challenges, there are societal challenges, economic, family challenges. There are so many of them. And so I think that in our approach to addressing these challenges and in our advocacy work as well, we need to recognize that it can't be one size fits all. There has to be a recognition that there are a lot of problems that needs to be addressed, and no one person or organization is the master of everything and able to do everything. We have to identify the strengths of each other, of each organization, of each group of people, and determine what they are capable of. For example, we talk about the problems with sickle cell disease, and apart from what we, the patients, experience at the clinic level, it goes far beyond. So if we take it on a holistic level, we know that there are challenges with policy, with research, with training of health workers, right? Then there are things with diagnostics of sickle cell disease. There are challenges with medication, therapies for patients. So we have so many problems with sickle cell disease that we can't assume that one organization is the best at everything, and let's say they are at their level and can solve everything, and then other organizations can just be at the level of education, because certain things are being left unattended to. There needs to be more research, there needs to be more training, there needs to be more diagnostics, So it's about all of us working together, recognizing that there are different strengths, there are different cadres of health workers and of researchers and of scientists and of just different levels of people who, irrespective of what their primary profession is, they are also, or they can also be advocates. So I can be a sickle cell disease researcher and also be an advocate for sickle cell disease research. And I can be an academic and also advocate for training of adding sickle cell to the curriculum and better training for the health workers, such that when Nani or Enam or Felix or Nanesi goes to the clinic, they get the best standard of care, you understand? So it's appreciating that it's a multifaceted problem and taking advantage of the skills of different sets of people such that we are all able to benefit. But then in saying this, I also want to say that for the challenges that you asked Nani for or Queenie for, there are also certain things that I have identified in my advocacy journey that I think that sometimes we forget about, right? So, for example, when we look at ethical issues, so as an advocate, I'm here talking to people about prevention of sickle cell disease or making an informed decision about sickle cell disease. But at the same time, when you're making that informed decision about sickle cell disease, sometimes to some people, the only option for prevention is primary prevention, which is not having a child with sickle cell disease. And at the same time, that can be something that can stigmatize people with sickle cell disease, because that's in a way saying, don't have a child with sickle cell disease. So then what happens to those children who already have sickle cell disease? So while we are trying to empower people living with sickle cell disease. We are trying to tell them that they can live long and live strong. In the same breath, we are also saying that because we know the challenges of our health system and the statistics that we have here and the fact that people don't have access to hydroxyurea and to penicillin V and stuff like that, there also needs to be some prevention of the condition. So then it raises ethical issues in our advocacy. Are we trying to encourage people to live long and live strong with sickle cell disease? Are we trying to encourage them to live each day to the fullest and make it count? Or are we trying to tell people to prevent it? So that's an issue that I think that for me, as I've grown in this advocacy journey, it's something that keeps on coming up. And that thing that also keeps on coming up is that there are various groups within this sickle cell disease advocacy space that need to be addressed. So yes, there are parents, there are patients. We, the people living with sickle cell disease, have concerns. We want to be cared for. We want to be nurtured. We want to be protected. We want our problems to be solved. But at the same time, there are also caregivers who have a totally different set of problems. And we've seen a lot of these back and forth happening on the Sickle Life Support Group page, because we have our caregivers who have a different set of problems and who think that they also need support, right? So a spouse, a parent, a child of a person who has sickle cell disease has particular problems. And then the person who also has sickle cell disease has particular problems. And while our work is to focus on the person who has sickle cell disease, we know that if we don't support their caregivers and their family, it may cause a lot of problems for the patient themselves or the person who has sickle cell disease. So this is something that, again, is an area of friction that we need to think about. And then finally, I'll talk about ableism and ageism. So there's a lot of ageism in our space where just by virtue of people being older or being around for much longer, they presume that their advocacy is more effective or efficient or better, and they look down upon newer forms of advocacy like social media advocacy and stuff like that. Meanwhile, we know that social media is a very, very powerful tool. And so sometimes the work that is being done online is discounted. And so that's something that keeps on coming up, and they think it's noise that is being made or it's just being out there in the public. While the social media work that is being done is just a reflection of in-person work that has been done. And so I think that it's something that we need to talk about. And finally, ableism, where in fact, sometimes, and we saw this at the summit, we don't recognize that we have pegged people with sickle cell disease against a standard that shouldn't really be the standard. We've pegged them against what we term normal. So then we start comparing a person living with sickle cell disease and their abilities to what we think a normal, in quotes, person should do. And so when somebody starts saying their child is maybe slower at something or doing it at their own pace, then we get the let them work, let them do this. If they don't do it, then it makes them lazy. Or if you are an adult with sickle cell in the workplace, then you start facing lots of discrimination or stigma because you are not doing your work at the same pace as everyone else. And these are all things that we are facing as advocates in this space, because we are having a lot of our children who are falling sick and their parents are thinking they are pretending. Meanwhile, it's the condition, it's the chronic fatigue, it's the anemia. You're having adults who have to keep going for reviews or are not able to keep their jobs because they are being fired because their employers don't understand that this is the condition they are dealing with. So then in the end, we realize that it's such a multifaceted problem. There's a lot that needs to be done. And apart from facing the actual problems that the people living with sickle cell disease are facing that we are trying to address and bring to the fore, we are also facing certain challenges with the work that we are doing, also being and bringing up certain issues that also need to be addressed. So I think that these are things that we also need to think about as we go out there and we are talking and we are like, live it to the fullest, make it count. And then in the next breath, you say, okay, but also make an informed decision. It's a little confusing to the public. These are things we need to think about. Thanks, Felix.
Thank you, Dr. Bankers. You've said a lot. I think you've covered things we are not there yet, but it's all good. We are all learning. You did mention, that indeed one size doesn't fit all when it comes to, doing advocacy, and there's the need for more research and training and even logistics, for our caregivers, for them to deliver good healthcare for us. And we know that at the end of all this, we want to live long and we want to live strong, and we want to live each day to the best of our abilities or to the fullest. You did also mention something in relation to the summit. In fact, I heard something interesting, that day. There was one lady from, I think, National Health Insurance who said there's sickle cell disease is one of the sicknesses that has been accepted in the NHIS, that if you go to the hospital and you are treated, you're likely to come back in a few hours or in a couple of days. Usually they don't disburse funds for people who have returned to the hospital, but it's not the same with sickle. In fact, she said a lot of things that were interesting because it looks like nice on paper, but I'm yet to see my health insurance actually operates, with some of the things that were said. But well, these are all policy and politics and other things that, we have to work around when it comes to advocacy. I did mention that Nanesi is going to take my next question, even though I noticed Dr. Bankers was hovering around that. So what do you think? Is forming a federation going to make advocacy for sickle cell patients any easier for us? Because it looks like one person cannot do the whole work. So should we just come together, become one, and then be able to deliver the work? Is this the way to go?
That's a very controversial question, Felix, but don't worry, I'll make an attempt at it. I'll just go back to your initial question, and I think I'll let it feed into my answer. I don't think that I'm not necessarily interested in being the best at advocacy. What's the best way to advocate for people who have sickle cell disease? I think we should be more interested in making sure that the advocacy that we do engage in is efficient and it's effective, because we're working publicly for a cause that is so near and so dear to our hearts, and it affects a great deal of people in our population, either by being, a carrier of the disease or having full-blown sickle cell. And so the work that we do should be effective and not one NGO necessarily wanting to be the best at it, which is a tall order anyway, especially in our circumstance. And so in attempting to be effective, I'll speak to your, do we all come together? My answer is, if we can do it effectively. If not, then again, how does that support the aim that we have to be able to make a change? Alignment is critical. I think we say collaboration, work together, collaborate, work together. To what end? We should be aligned on the destination. We should be aligned on the modalities. We should be aligned on the execution and the approach. And so, yes, if we can find that alignment and be agreed, then of course, why not come together and make sure that all the heads are better than one? If we are lacking that, I don't think we come together for the sake of coming together. Again, we should always be asking ourselves the fundamental question, which is, how does this make our work better, easier, more impactful in a positive way? And anything that furthers that cause in that direction, 100% I'll sign up. but that clarity should exist before the fact, instead of deciding we must come together and then reverse engineer our way into seeing how that is going to be actualized. So I hope that answers your question.
Thank you. I think it not fully, but I will take it. I think I'll allow Enoch to help me out if he can. You did mention that we need to align. I mean, aligning means we need to have one voice. We need to be saying the same thing. So to Enoch, we saying the same thing, will we get the needed, results we want from advocating for persons living with sickle cell? Do you think the government will listen to us if we all decide that, you know what, this is what we all believe in, and we want to push, just like I said about the NHIS, there seem to be a lot of things in there that's impractical. It's not out there. I mean, people are paying for things that they are not supposed to be paying for. How can us having one voice change this? And this goes to Enoch.
Hi, Felix. I was going to use the perfect line I've been saving all night, which is you said it all, but you've completely robbed me of the opportunity by changing the question a little bit. Well, that's okay. So Felix, I think that having the same voice and aligning on objectives and goals gives us leverage. It gives us a lot of leverage. That is the most powerful thing about collaborating. The more you collaborate and you're aligned, you have a lot of, especially when it comes to making policy changes and even seeing that reflect in the lives of persons living with sickle cell disease. Because it's one thing to say that national health insurance covers this and that, and it's another thing, experiencing it. If you already experience it, so you don't need a piece of document to tell you that it is there. You get it. And so collaborating is great. It gives us the leverage, but it doesn't also end there. I mean, you have the leverage, and then what? You get it. You need also our approach. If we want to make changes, especially at the policy level, you can have one organization do that. Novartis was fighting recently, in recent years, to have their medication on NHIS, list of medicines, and they did that without all of the NGOs in Ghana coming together. We as persons living with sickle cell disease and organizations, when we come together, we'll be able to fight for much more and get that. But we also need to have people who understand what we are doing, actual people in whether it's parliament, whether it's in the subcommittee for health, whether it's at the Ministry of Health or in NHIS. We need people like that who would also be aligned to our cause and seek to push these things, that they are real policy changes. Because you can make all the noise that you want. And we've seen that I don't want to be political, but we've seen that happen a lot of times in this country. You can make all the noise you want, whether you don't want a certain bill to be passed or you don't want, and it will still be passed and it will be done. But if you have access to the right people in the right places, then you would see the policies that you want you see them in black and white, in the bills that will be written, in the policies that will be made. And then you'll also see that manifest in the hospitals and in all of the other places where you want to see change. So a large part of what we also need to focus on is coming together to also reach the right persons in places of power that we can. And I want to say this, one of the proudest moments I've had as a volunteer with Sickle Life and also working in partnership with Sky was when a minister and member of parliament issued a statement that wasn't pleasing. And I remember Nanesi and Enam coming together and saying, look, we need to call this man to order. And letters were written and calls were made and all of those things. And a public apology was issued. That is the sort of thing that we need to do. And once we do that, first there was a collaboration. So it's not just, okay, Sky and Sickle Life and we don't like what this thing said, blah, 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 blah. You also need to reach the people who are in power and then cause them to make the changes that you want to make. So we need to also align with people in power, whilst we also align with ourselves with the leverage that we have. You can't have an organization that's, for example, say the Sickle Cell Foundation, talk about something, and then say the association is also talking about something else. You can't also have all of us come together, say, like what Novartis is trying to get us to work towards, like a federation or an association for all NGOs, and then we'll be divided on our approach. So both goes hand in hand. First align, then find people in power who will be able to make the changes that we want to make. That's the only way it's going to work in the society that we are in. So that's my 2 cents.
Thank you so much. I think we all agree on one thing. First align, and then we'll be able to deliver on the others. And this next question goes to all my panelists. Enoch did mention about policy. How do we move, into getting the right policies in favor of persons living with sickle cell? I mean, at what point do we say, now we are ready, to engage government or social welfare or the health sector to draw policies, that favor persons living with sickle cell disease? Dr. Bankers, you can start for us.
I was just thinking, can I be controversial and say that I have decided not to commit my time and effort into, in the words of a wise man, hammering the government. I feel like we spend too much time and effort on them. And I can see you. Like, I think that we spend too much time and effort in trying to get them to be concerned about these things. And I know they are the most, technically, once we get them on our side, we can get a lot done. It was because they finally agreed that, for example, we got this medication on national health insurance, and there are lots of things that we can do with them. But then I look at a policy document that was created in, was it 2011, that stated what African countries should do for sickle cell disease. And no African, sub-Saharan African country has been able to achieve any of those things. I look at the 2008 declaration of June 19, that as World Sickle Cell Day, and all the things that were supposed to be done by our presidents and our foreign ministers and the first ladies of these different countries. And after so many years, nothing has changed. And I remember, I think it was 2020, I made that speech and I said that after that declaration and after that document has been made, we can count the number of our comrades that have died since those documents were created. Like, I can start mentioning the names of people I've lost to sickle cell disease. Those documents were created and nothing has changed. You understand? So for me, I know that in some ways it's important as an advocacy leader to focus on the government because they are so critical in all of this and they can get things, it makes life easy. But at the same time, again, different people have different strengths. So I feel like let that be someone else's strength because I have limited strength and they are not, I don't want to commit so much time and effort to them. It's a controversial thing to say, but then I'd much rather, for example, spend time and effort in working in, let's say, the health system, such that we are training more healthcare workers, such that they know more about sickle cell disease. So we are improving the curriculum, such that medical students and postgraduate students are learning more about sickle cell disease. I'd much rather spend time in maybe working with the Allied Health Council, such that they are improving diagnostics for sickle cell disease, like the tangibles. I know on a larger scale, once you get government to do things like maybe newborn screening and certain other bigger things, it makes life easier. But I mean, Prof. Solomon said it. Prof. Wahini Frimpong chased the hydroxyurea thing till his death. Literally, they had to announce that it had been put on NHIS on their way to the funeral, because it would be shameful for them to get there and not have done it. So I feel like I don't have the time or energy to die and not have achieved the things I want to achieve because I'm chasing after politicians. So for me, I don't want to commit energy there. I feel like other people should take on that one, and I would focus on other things. Sorry, but not sorry.
Thank you. Sorry, but not sorry. It means there's still a lot for us to do. Nanesi, do you want to share your thoughts? Do you think it's time for us to move into policy making?
I think there is no such thing as a time for us to move into policy making. I think policymakers should be a part of the conversation from the very beginning. They are critical stakeholder. They are not the people who come in at the end when we've done everything else. And so it's time for them to tack on policy to support our efforts. They are a part of the conversation. We are keeping tabs on the work that we're doing and then feeding them information on where there are inadequacies. And the inverse is true. And so there is no good time, the same way there's no good or bad time for advocacy. It's an ongoing process. And so if we feel like one issue that we've identified is that we don't have enough support from policymakers, then that becomes our role as advocates to ensure that we kickstart that conversation now and involve them now. So we're not catching them up on the work that, it's actually, I think policymakers should be the biggest advocates for people, everyone in the country. And so I don't think that is up to us. We are a certain group of stakeholders who are pushing the mantle forward, and they will pass a baton to them at some point. And if, again, it's a conversation that's controversial enough to elicit such responses, then I think it goes to highlight that in and of itself is a challenge. And then we can move the conversation forward as to how to address that challenge and address it effectively.
Thank you. Thank you. I think you said one very important thing, that policy making should be part of our advocacy right from the start. And there's no time to give up. I mean, we need to keep pushing as much as we can till we begin to see the results that we want. Fortunately, it was sad to hear the story that, Professor Frimpong pushed for hydroxyurea for a long time till the very last moment. I mean, we deserve better, and we hope we get there one day, and the policymakers will now be our advocates. Enoch, would you want to share your thoughts? I know you mentioned something in your presentation, but I still want to hear from you on policy making. I think,
Oh, guys, I'm sorry. Just having a device challenge. So Nanesi has said it all. Don't mind me. But yes, I completely agree with Nanesi when it comes to policy making. It's critical. It's not a thing that you think of later, or you say, okay, fine, let me do this and this and this, and then later I'll move on to addressing the issues that people in power in government and institutions can change. One of the things that was highlighted at the summit was even the lack of, and I can speak to this, standards when it comes to the treatment of patients when they get to the hospital. That in itself is something that we can fight for and address, and it goes a long way to making sure that at any point in time when someone visits the sickle cell clinic anywhere in the country, they are assured of a certain standard or basic practice, and it's not like the experience Nani has say, oh, and there's Wababium. No, that shouldn't be the case. So it's very important, and the sooner we get on with it, and it doesn't have to be, see, the thing is, like I just highlighted in the example, it doesn't have to be something that is so huge and out of reach. Those things take time, and they may take lobbying and money and all of those things, right? But something like a standard you can fight for, and make noise about it, speak to the people. I believe if we were to dig deep, we'd find so many things that are not so out of reach that we can actually find solutions to pretty quickly. So we need to start doing those things, and bring in some form to it. We don't have to wait until we are. You don't have to even like what we just talked about. Professor Ahine Frimpong. It was just one man. You don't even have to be a Sky or a Sickle Life, or as an individual. If you have the right connections and you have the drive and the passion for it, align with those who also have the same goals, and then we can begin to see changes from a policy level. Thank you.
Okay, thank you. Nani, would you want to share your thoughts?
Yeah, okay. The little I can say is, as they've all said, the policy making will also come from us, because the more we advocate, the more we align with other advocacy group, we'll get people who are part of other groups that are going to help us, or are even closer to some of the policy makers in the government that will help or hear us and also assist us in certain things. But with all they've said, it's okay. It's okay. But let's look out for the best that we can do to help sickle cell and help the patient to have a good health care, and also caregivers understanding them. Then we'll leave the policy one to the policy makers when they hear us, and when we have the connections for them to hear us out. Thank you.
Thank you. In fact, I was going to ask what kind of policies, but that would take us into another hour. But you said something that the more we align and have a voice, a single voice, then we'll be able to dictate, the kind of policies that needs to be in place to help us as persons living with sickle cell disease. So to my last question, how does the future look? I mean, for sickle cell advocacy, and this goes to all my panelists, then we can go into question time. How does it look? I mean, we know where we are. I believe we still have a long way to go, but how does the future looks like for advocacy? I mean, for persons living with sickle cell disease.
I'm very optimistic about the future of sickle cell disease advocacy, especially because with digitalization, I'm seeing a lot of international collaborations. We are having access to a lot of conferences, both locally and internationally. So we are able to learn best practice. So we don't have to limit ourselves to this space. We don't have to be limited by whatever obstacles are placed on us within this space, because we get the opportunity to engage with others out there and to learn from whatever they've already gone through. And so it's surprising, but then in a panel I was in recently, an international panel, it was very clear that despite the fact that we were from the US and UK and Ghana and I think it was Zambia, the challenges that we face in the sickle cell community are the same. And it's amazing, first world and third world, but in 2022, we are facing the same challenges. So having these kinds of interactions enable us to learn from each other, and also from the experience that Sickle Life has had with respect to people not being aligned in terms of the objectives, having challenges with partners and stuff like that. It looks like time solves all the challenges, because despite all the difficulties we've had, we've also come a long way and met an excellent partner that is almost identical to us in our thinking, in our ways and how we operate. And it's made it such a very fruitful partnership such that we are able to accomplish a lot together. And so this makes me very optimistic that we'll be able to do a lot more together. And yes, we have a lot of challenges and they've been outlined already. But for me, I think that as has already been mentioned by my co-panelists, we have to identify those who are aligned with us, look at what are the key things that we want to do together, not just collaborate or work together for the sake of doing it, but then find a way such that whatever thing that we are doing together ensures that we are doing it in the most effective and efficient way. I think that with all these things together, the sky is just the starting point for me, because I know that there's a lot that we can do together. So I'm very optimistic.
Okay, thank you. Thank you so much. The future looks really bright and the sky is just the start. Nanesi, what do you think?
I am 100% aligned with Dr. Bankas on this. I think we're optimistic. We're hopeful for a lot more valued partnership and collaboration together. So we are excited about that. But on a wider front, I was actually really hopeful when I attended the Summit for Advocacy, and all these PAGs are represented there. And I was inspired, not only because we were saying things to each other that we felt like we all wanted to hear, but our challenges were the same, our frustrations were the same, our expectations were also the same. So even though sometimes the actualization of these things do not come without setbacks and roadblocks, we want the same thing. And if we're willing to do the work, if we're willing to aim to achieve more, I think I spoke a little bit about this in my presentation, that we should be willing to accelerate the change that we want to see. We should be willing to invest in impactful outcomes, and we should be willing to mobilize. And the fact that there's alignment on that conversation, and we're willing to do that, it's a source of inspiration for me, and it can only get better. We're learning. And so I don't see, maybe let me say, a scenario where there's retrogression instead of progression. I think that we should just need to squarely fix our eyes again on where we're going and then do the work to get there. And I'm confident that if not for anything, that there are a few of us who are willing to do that work and make sure that it's moving onwards and upwards from here. So I would say, yes, the future is bright.
Thank you. Thank you.
Thank you.
Enoch.
Hi, Felix. Okay, so what the future looks like, I think it's even started, we are having the right conversations, right forums. A few years back, there weren't conversations like these, so we're having the right conversations, which is also helping us identify what the gaps are, what needs to be done, what the resources, what resources we need to gather to solving those gaps that we are identifying. And then there's also collaboration and alignment, possibly, more coordinated effort, but that doesn't just sit with one organization. It depends on what we would all come to and the general attitude of all the people involved, whether they are individuals or NGOs. So those are the things that I see happening in the future. That will be having and hopefully, once you're able to figure all of those things out, it would lead to putting pressure in the right places for policy changes and new policies that would actually help the masses and cut across everywhere.
Okay, thank you. Also, would you want to share final thoughts?
Yeah, thank you, Philip. I'll talk as a patient, and I see the future to be very bright. It's really, really bright. And as a patient, it has helped me a lot. And I can talk for those on our page that due to this advocacy group, we are able to stand out for ourselves and for people living with sickle cell. So the only thing I can say is those our heads who have created this group should look out for the challenges that we have. Then we should take a bold step and push forward. Let's push forward for people to hear us out, for people to understand us, for people to join us and also have the same mindset with us. Though it will be difficult in a way, but if we strive for it, if we push towards it, we are going to make a very big difference from now. I think when we do that, we'll see a brighter and a brighter future. And to my people who joined us, I know they've learned a lot. And because of this, most of us are able to stand out for ourselves. Most of us are able to come out and advocate for people living with sickle cell. So I see the future being bright if we all come together, join heads together, and find out our challenges and strive towards it. We'll get a bright future ahead of us. Thank you.
Thank you. I think my mic was on mute. Okay, so we'll take questions now. If you have any questions, you can either leave them in the Q&A. I don't know if you have a Q&A, but I think there's a chat box. You can leave them in the chat box. Or you can just unmute and then ask your question. Whilst we are waiting for our questions and looking through our chats to see if there's any question. I want to ask my panelists. We've talked about the future.
Hello.
Okay, Mr. Amponsa.
Hey,
Can you go
Felix. Okay, mine is not really a question, but a small contribution that I have. I've
Okay.
been listening through the various conversations, and I must say it's very insightful and eye-opener in a sense. I have a few comments that I want to pass. First of all, one thing I've realized is when it comes to advocacy, focus is key. Focus as in who are we actually advocating for? No, a lot of times when, especially in a space where you have a lot of groups advocating for the same thing, it gets to a point where the focus moves from those living with sickle cell disease to the organization itself. And so you find a lot of times we'll start, I don't know, for want of a better word, fighting amongst ourselves to see which organization is actually superior. Is it Sickle Life? Is it SCI? Which of them is really out there? And then we lose focus of the fact that we are not fighting for the organization, but we are fighting for people living with sickle cell disease. So focus is really key. And if our advocacy is going to really make an impact, then we should always maintain that focus. Let's put persons living with sickle cell disease at the center of our advocacy. Then the other bit is when it comes to there was a point being raised about whether we should get into the the policy making phase or we should still stick to our small corner. For me, I think that there are also subtle ways to implement or to influence the kind of policies that are made. Our various offices, our various institutions that we are in, how many times do we actually chip in things related to sickle cell disease? How many times do we even make our impact felt there? And so if we don't get noticed in that area also, it's going to be difficult trying to affect the policy making phase when it comes to the advocates that we are trying to do. It's good to get there, but whilst we wait to get a bigger platform, let's do the subtle approach of implementing or trying to influence the various policies that are made. A lot of work is being done, I know, but I think we can still get on to do more in that regard. Then I was also looking at our own individual way of advocating for persons living with sickle cell disease. Most times, even on our platform as we speak, I wish there were times that we can have engagement and ask, okay, in your own institution, in your own home, what did you do to talk about, let's say, SCD in that area, in that institution that you find yourself, in that school that you find yourself? What did you do? Most times, you know, the narrative gets to the kind of bad reportage or bad encounters that we had. Granted, those are the realities. We'll keep on suffering them. We'll keep getting people putting us through all of those things. We'll keep people giving us all those negative energy. But the question is, in our own small way, how are we also advocating for persons living with SCD? How many times do we talk about the disease? How many times do we educate people about its effects? How many times do we even get people to come to realization that we are not trying to, we are not pretending, but it's the reality on the ground and XYZ is the cause of it. Most times we don't do that. And so once we are not subtly telling people our story, they will put out their own narrative. Because it's like this, if you don't tell people who you are, people will address you how they want to address you. And so it's that time that on an individual level, we pick up advocacy in our schools, in our churches, in our various institutions that we find ourselves. We should let our voices come out. We shouldn't sit and wait for people to, you know, tell a certain narrative about us, and then we will now be struggling to catch up with them. But if we put the story there and amplify it, a case in point for this program that we are having, how many of us even put it on our statuses? How many of us even invited people to join? How many of us even, you know, went an extra mile to go on our social media handles to talk about what is going to happen? A lot of us did not do that. And I think that is where the advocacy should start from. It should start from our very doorsteps. And once we keep doing these little things, you realize that it will be like, you know, when there is a rolling stone in the ice, it will keep gathering, it will have a ripple effect on others. And I think it will also help our quest to get our voices there. Thank you.
Thank you, Mr.
Thank you.
Amponsa.
Next time.
Yeah.
So Mr. Amponsa, thank you very, very much for your submission. I think that Krista, can we take note of what he said regarding the something on the support group where we ask people what they've done for advocacy, maybe like around major events, but also for programs like this. And we ask people whether they've posted and what they've done personally to share it. And he raises a very important point. I think that we talk about advocacy, but a lot of us try to be separate from our sickle cell disease advocacy. We don't want to be associated with the condition in our personal lives. So maybe we'll share a sickle life or Sky post, but then we don't want like to tell people our individual experiences with the condition. And as you said, people would make assumptions of the condition for us if we don't tell the stories, because for everybody who sees us on the outside, unless we tell them that, yes, you saw me looking nice right now on the screen, but then I'm in pain and I've taken painkillers, they don't know that that's the reality of living daily with sickle cell disease. So it's difficult to then say that in a week, maybe I can only work 3 out of 5 days, when every time I see you online, you're looking glamorous, you're looking fab, but then it's their daily struggles and daily challenges that we fail to talk about because we don't want to, maybe it's because of the stigma, but then we have to realize that we all have a role to play. The organization can do its part, but then all of us also have to take on the task of being advocates for the condition. It is by doing that maybe your policymaker, your boss, or whoever you want to influence can tell that this is a real life thing. But other than that, realistically speaking, for a lot of people who don't have an actual relative or haven't had a close encounter with somebody with sickle cell disease, it doesn't look that bad, because in between the times when we are sick, we look great. Like we clean up very, very nicely. So if we are hiding the things happening in between, then really, what do you want them to lobby for? What do you want them to fight for? Because then you are just saying it. You only show them when things are great, but then in between, they don't see why they need to be advocating for you, because every other time you are looking great, you understand? And so for me, it's that telling those stories such that people can identify with the struggle or identify with just the experience of living with the condition and why it's important for them to support us. It's something that is important. And yes, you actually, it's one of the things that we fail to get alignment on. That, for example, between Sky and Sickle Life, we can work together and we are not bothered about your logo is here, my logo is here, you're not appearing in the picture. Like, we don't worry about the organization. But sometimes when we go out and we are trying to collaborate, unfortunately, that becomes an issue. That, oh, why is Sickle Life saying they are the bigger NGO? Why is Sickle Life leading this? Why is, then the petty squabbles like that? And again, nobody has, we have important work to do. There's so much to be done in this space that hasn't been done. And so once we start having those kinds of challenges, then it becomes like, let's move on. Let's get somebody who is interested in doing the work and not these petty things. So that's a very, very valid point that you raised. Thanks.
Okay, thank you, Dr. Bankers. So advocacy is not just for the organizations. It starts with the patients, and it's the mandate of our caregivers too. There are a few questions here. I'll read all of them and then probably assign to our panelists. So Della is asking, if Sickle Life and Sky collaboration is yielding desired results, is it conclusive to say that the more SCD NGOs are absorbed under one umbrella, the better our advocacy goals achieved. Nanesi, can you take that for us? Okay, let me read the others so that once you are done, you just follow and answer. Darlington is asking, in our world of advocacy, is it based on mostly the health sector or other areas as well concerning sickle cell disease? I'm sure Dr. Bankers will take that for us. And then Eli is asking, question to all panelists, what do you hope to achieve with this advocacy? What's the end results? Are we hoping to normalize it for people to comfortably associate with them, or we hope to let accept us? This is a really good question. And then this is from Sickle Life. I don't know who is representing Sickle Life here, but it says, Eku Anido, Facebook. I pray that someday someone starts a sickle cell specialist hospital where we attend to and treat well. Where you are attended to and treated well. Okay. So let's start from the top. Nanesi is taking the one umbrella question. Then Doc would take Darlington's question, and then there's Ellie's own for everyone. And then the hospital one will also be for everyone.
Okay, my answer to this will be quick. I think I spoke to this when the question was asked about the federation, which is that the more of us under one umbrella, the better. Again, I think it speaks to us doing it effectively, us aligning on our outcomes, our desired outcomes, and doing it effectively. Going back to your question on the federation, I'm sorry, I don't think that the conversation here has ever been federation in place of the individual targeted work that each PAG or NGO is doing. I think it's in the sense in which it has been proposed as an umbrella entity that helps us have a stronger voice. Again, so with that in mind, then we need to be clear on what that voice is saying. So everything around this question is alignment, and that is the conversation needs to be had further, it needs to go deeper, so there's clarity on what we want and what that voice will say, how it will say it, and the results that we want to achieve. And the reason why Sickle Life and Sky are able to yield the desired results, like Della mentioned, is because we are completely aligned in what we want to see. And in each of our collaborative projects, and even when they're individual projects, we will go and support each other because, again, we are completely aligned on the outcome that we want to see. And so the more people you keep adding on to that, the more important it will be that that understanding is there. So thank you for your question, Dela. I hope this is useful.
Okay, Dr. Bankers, so kindly take Darlington's question and then that's of the one from Facebook.
Oh, okay. One from Facebook. It was just, I think, a comment that they hope that we get a specialist hospital.
Oh, okay. It was just a comment. Yeah.
I think Darlington's question is basically that are we only focusing on the health sector or other areas as well? So I guess maybe from his experience with us, our efforts seem to be overly concentrated on health-related issues related to sickle cell disease. So that may be where the question is coming from. And I guess the reasoning behind that is that sickle cell disease is a medical condition. And from a lot of the conversations we've been having, and every time we ask people what their problems are with sickle cell disease, most of the problems that people raise are with respect to how they are treated in the hospital, access to care, financing of care, and stuff like that. So that becomes a primary area of concern to us. But then apart from that, we also know that there are other social and economic aspects of sickle cell disease that we also need to think about. So in terms of, for example, the younger ones not being able to go to school, people being stigmatized, the older ones not having access to work and things like that, even relationships and the stigma that comes with it. And so we try as much as possible to engage in a lot of these things. And you realize that, for example, and this is just one program, in Let's Talk Sickle Cell Disease, over the months, every time we've talked about relationships, we've talked about, we have a talk about welfare coming up. And so these are ways in which we try to engage with people for things apart from health, because health is a key thing that we have to address. And once your health issues are addressed, it can free you up to also do some of your social issues. So I guess maybe we'll take that point that it seems like we may be overly focused on the health-related issues, but then I can assure you that we do other things. When you take the mentorship projects, for example, when we go there, we talk to these young people about peer pressure, career guidance, alcoholism, all these kinds of things, so that they can be able to make good choices with respect to schooling and stuff like that. So I can assure you that we don't just focus on the health-related aspects, but then we try to support people. And in other ways as well, there's also support in terms of assisting people with trying to find jobs. There have been opportunities where there've been like webinars such as this, where they get training on how to go through an interview, how to submit a CV and stuff like that. So we try to be as holistic as possible, but of course, health takes a chunk of the work that we do. So
Okay.
To answer the question.
Thank you, Dr. Bankers. I see a hand up, Priska. We are, I think, way ahead of our, our time, so just make it brief.
Okay, my name is Priska, and what I wanted to say is that sometimes in the quest or attempting to help persons living with sickle cell, everybody just wants to advocate and advocate and advocate, leaving the patients rather behind. Like, I don't know how to make you guys understand this, but then I feel like, okay, so we want to make life better for persons living with sickle cell. So let's get them a good hospital. Let's do this for them. Let's do this for them. Then they go like, okay, so in order for you to be good or to have a better life, choose this partner. In order for you to be good in life, you have to work hard. You have to do this. Like make it. When I was a kid, mom took me to the hospital. Yeah.
Priska, I'm sorry, but our time is far gone. So thank you so much for your contribution.
Let us advocate for ourselves.
Thank you.
Assuming for us.
Thank you. I'll give 1 minute each to my panelists. Okay, 2 minutes, please. No, 1 minute. I don't have minutes to give. 1 minute, because Ellie's question needs to be answered. Exactly. And I think, you know, this is a very holistic question he's asked. And I would plead with you that this is like the last. So kindly try and be brief and cover all the basics. I mean, he's asked 3 questions here. Or what do you hope to achieve with this advocacy? What's the end results, which also is more like the same? Are we hoping to normalize it for people to comfortably associate with them, or we hope to let them accept us? 1 minute each. And this one, I have a timer. So from the top here, so Dr. Bankers is on the top of my list here.
before I answer Ellie's question, I want to say that Priska is talking about, you can add it to my 1 minute. Priska is talking about ableism that I mentioned, which is the fact that people try to associate us with certain societal standards. And so then when you are talking to people with sickle cell disease, you try to tell them what to do and put them to certain standards. So there's this person, do this job, you can only attain this and you can only do that. So the advocacy is for the person living with sickle cell disease, and you are speaking for them. So don't tell them who to be or what to do or who to associate with. Listen to them and be their representative. Now, regarding Ellie's question, I had also mentioned that there are these ethical issues where we are talking about, okay, live it to the fullest, make it count, live long, live strong. But at the same time, we go out and then we tell people that make an informed decision about sickle cell disease. And for some people, the only informed decision they can make is primary prevention. That is not having a child with sickle cell disease. But at the same time, for some people, they can do secondary and even tertiary prevention because they can have the child with sickle cell disease and cater to their needs, go for bone marrow transplants, and provide them with hydroxyurea and the likes. So for us, we always say that we'll give you all the information, but it's up to you to make that informed decision about the condition. As I said, we came in to educate people about the condition, but then we realized that there were other needs in the space. And so once we came in and we realized that there was a need to care for people with sickle cell disease and to educate them and to provide their welfare needs and stuff like that, we had to broaden our scope. And so now we are doing both. And I don't think that they are mutually exclusive. You can provide for people who have sickle cell disease and you can improve their quality of life, while at the same time telling people that, look, this is how living with sickle cell disease is. At the same time, based on that information, these are the options. Make an informed decision about the condition. It's all up to you to make your decision. And that's basically what we are doing. So everything is presented to you. You make that informed decision by yourself.
Thank you. Thank you. It's beyond your 1 minute. Please, Nani, you are the next on my list here. And kindly make it as brief as possible for me.
All right. So what I'll say is we are doing both. We want people to accept us, and we want to normalize situations for people living with sickle cell. We want people to understand us and accept us the way we are by not dictating for us and telling us what to do. So we, the people living with sickle cell, to have to come out bold and advocate for our own self to make living very simple for us as well. Thank you.
Thank you. Thank you so much for keeping to your time. Nanesi.
Hi, Felix. I concur with Enam and Nani, who has spoken brilliantly to it. And I'll just speak to our vision statement, which is to see a world where people living with sickle cell disease live a long and fulfilled life, free of stigma and free of limits. And so that's the core underpinning of all the work that we do. If I have more time, I'd like to donate it to Priska, who was making an excellent point, but that's it from me.
Thank you. There's no more time, so we'll go to Enoch.
Hello, hi guys. So on Ellie's question, wouldn't it be great for all of us to live in a country where sickle cell advocacy groups are not needed? Think about it for a second. That is the reason why we do what we do. Whilst it might sound like an ideal scenario, like a fantasy, we work each day and strive to make that fantasy a reality. So that is it. That is my answer to your question.
Thank you. Thank you. Thank you so much. Thank you, Enoch. Thank you, Nanesi. Thank you, Nani. And thank you, Dr. Bankers. And I think applause to Priska. I think she summarized everything for us. Unfortunately, we didn't have enough time for her to even get to explain herself. But the whole focal points for advocacy is the sickle cell patients, and that should not be ruled out when we are doing advocacy. And at the bottom of at the top of everything that we've learned today, you are supposed to advocate for yourself, and we are encouraging our caregivers to also advocate and have in mind that they are actually advocating for the sickle cell warrior, not themselves. And our organizations that are doing the great work out there, align your work with policy so that in the long run, at least, there will be better care for persons living with sickle cell. Thank you all for making time. We've exceeded our time by almost 30 minutes. This is not how we do it, but I believe the conversation calls for this time that we've exceeded. Thank you all so much. Hope to see you soon on the next Let's Talk Sickle Cell Disease. Have a good evening.
Thank you very much, Felix. Thank you, everyone.
Thank you.
Thank you.